Perhaps I ought just to go through the ways in which psychiatric art has been used, and first in a psychoanalytical way, as if it were dream material, and this frequently leads to discussion. Secondly, by way of psychotherapy, and everybody's looking, particularly in the States, to get briefer and briefer psychotherapy, and so this is supposed to be a way of cutting that down, and certainly it's a means of communication. Thirdly, I'd like to call it auto-therapeutic, if you like. A number of people, I'm sure, just paint themselves well, and they discover what was really at the bottom of their troubles, and often enough are relieved. And there are some people who paint and paint with the most, in the most prodigious sort of fashion, and will produce literally hundreds of paintings. And when one examines them, you spread them out on the floor, and we recently spread out some 1,500 or so to examine them, and this is the only way, I think, that you can adequately do this. Then, for diagnostic purposes, and this has been our own interest, and I'll say a little more about that in a moment, but essentially to point out the symptoms and record them in a permanent sort of way. Then there's the mass of art therapists, and there are many of them in the States, as you know, they're trained, and when they've undergone this training, it's really on a semi-analytical group basis, and the products come out of groups and discussions and suggestions in this sort of way. Then there's the work of the occupational therapists towards finding an interest and a hobby. And lastly, I suppose one can think, and very importantly, of the side of pure art and for research.